for those of you coming over from the CE sessions, you'll know Carolyn and myself. I'm Ben Turley as Global Marketing here at ZEISS, and we're here at our California Innovation Center. And this is our Customer Experience Center, where you can come and enjoy and use and utilize the devices. Obviously, I'm teasing you, you're all online, but please, we're always here, open doors if you're ever passing. So, Carolyn, your presentation was fantastic, obviously talking about AMD and GA. We from ZEISS have an AMD and GA toolkit. How do you utilize that AMD and GA toolkit in your institution?
Yeah, I think that toolkit is really great for detecting advanced macular degeneration, which we know can come in two forms, right? So geographic atrophy or neovascular disease. So I love the sub-RPE slab in-FOS analysis, or the Advanced RPE Analysis portion of the interpretation on the OCT, the CIRRUS, for visualizing geographic atrophy and then assessing how it's progressing over time. And then using both the structural OCT as well as OCT angiography, angioplex, in order to assess if an individual has neovascularization. And, it's incredible that with OCT angiography, we can detect neovascularization with OCT angiography before we see the exudative features like fluid or hemorrhage on fundus examination. So I think OCT angiography really affords us the opportunity to detect neo in its earliest form. And OCT is the primary imaging modality for geographic atrophy, right? We're going to be able to visualize the earliest impending geographic atrophy. And then once it's present, monitor progression. And ideally, if you have a patient undergoing treatment, seeing that the rate of progression is slowing with therapy.
Yeah, 100%. And obviously, you mentioned there those slabs, the sub-RPE slab, for example, but those unique advanced features within Advanced RPE Analysis, how do you use those unique algorithms to effectively assess your patients, and have they changed the way in which you assess your patients compared to, let's face it, what we had previous, which was just that structural B scan without any analytics or any of these, as I say, advanced algorithms that are unique to the CIRRUS product?
Yeah, having the quantitative features in the Advanced RPE Analysis, specifically the sub-RPE slab, right, where it's actually giving us some quantitative data and graphing for us the change in geographic atrophy area over time, as well as the distance, the closest distance to the center of the fovea, is of real value, right? Because then you're able to assess if geographic atrophy is coming for the fovea. And when it hits the fovea, that's when you're going to have substantial vision loss from geographic atrophy. And, it's a great way to monitor progression of geographic atrophy rather than visual acuity, right? Because the patient's going to be like 20/20 visual acuity until all of a sudden the GA hits the center of the fovea. They may go from like 20/20 to like boom 2200 in the course of just a few weeks to a month or something, right? So it's a great way to monitor progression over time, even when the visual acuity is good. And quantitatively, I think the ZEISS Advanced RPE platform is the only one that offers quantitative analysis, which is very valuable.
Yeah, that obviously we're biased, yes, and we're very proud of that. And the reality is that over my left shoulder we see the Claris, for example. We can do our FAF, if you like, our fundus autofluorescence. We can see visually the pathology within our patients. But as you mentioned, the metrics, it's the analytics that actually allow us to give a definition not only to the to ourselves to make that analysis, but also to the patient in some respects, because to the patient it's just an image. It doesn't necessarily mean anything. In fact, some of the images, the big red Mars picture over my shoulder doesn't mean anything to the patient. The algorithms, etc., that we see here might not mean anything, but when you put a number against it, then not only can we as a physician look at that and say, yes, there is change, it's minute change, but you can see it, but maybe also patient education is an element.
Absolutely. I always love including some image to show the patient in my patient education, because then it becomes real, right? And you may have a patient who, even has good vision and they're kind of like in denial as to what's actually going on with their eyes, because it's scary. It's so scary to think that you could possibly lose your vision. But when you're talking about a therapy and trying to, act in their best interest and educate them on all the different treatment options that they have, I think it's important that they fully understand the nature of the disease, and that geographic atrophy is progressive and irreversible. And if you have documentation of that geographic atrophy progression, and using the advanced RPE analysis, you can show them those sequential or serial, like in FOSS OCT images, where they can see the geographic atrophy changing over time and be like, oh, that's my eye. Yes, I can see that is getting worse. I think there's a lot of value in patient education.
So then, I suppose, jumping back to effectively what we've been chatting through the sequences is dry AMD therapies. These new dry AMD therapies are exciting for our patients. We couldn't do anything for them previously. We would monitor and we would maybe illustrate to them that this is happening, but unfortunately, there's not a lot, if anything, that we could do for them. So these algorithms that we speak of, whilst we baked them into our products, previously, they were not as valuable maybe as they are today, because today it's almost like we collect this data to effectively enhance our record of the patient. But now in the future, you could say we could utilize, well, and the future is now, because we can actually use these dry AMD therapies with our advanced RPE analysis and monitor exactly what's happening. And again, back to the metrics that are really helping us.
Yeah, absolutely.
So the other element, of course, since we mentioned dry AMD therapies, the other element of that AMD and GA toolkit is, of course, the unfortunate effects of the dry AMD therapies that can lead to effectively an exudative, a wet AMD situation, where we're seeing fluid within our patient under treatment. And of course, that's the last thing we want to see. We want to jump on that. We want to react as quickly as possible. And so again, the AMD and GA toolkit from the CIRRUS device is not just advanced RPE analysis, it's angioplex, and angioplex is OCT angiography. So we mentioned angioplex and OCT angiography, but how do you utilize, what is OCT angiography to those who haven't experienced it before, and how exactly does it help you in practice?
Yeah, so OCT angiography allows us to directly visualize neovascular membranes themselves, versus previously we're just using structural OCT. We see the secondary effects, like the fluid, the thickening, the edema. Whereas with OCT angiography, we can visualize the blood vessels and how the red blood cells are flowing within that neovascular complex. So we're able to detect neovascularization using angiography imaging before it becomes exudative and starts leaking out fluid or hemorrhaging in the retina, right? Or leaking on fluorescein angiography. We can pick it up so early on in the course of the disease and then monitor it closely. The first time there's fluid or hemorrhage, boom, you refer it to retina for anti-VEGF therapy.
Superb. And that, obviously, that's chasing, for example, scarring, etc. But basically, that fluid we all know is going to massively change their vision. And yes, we've always had those wet AMD therapies. We know that they're successful, but hey, as you mentioned, if we can jump on them before we even get to that stage, that's where the OCT angiography really sets itself apart from the structural side of OCT. So it looks like we've got a question, and I'm going to ask my wonderful colleague Kimberly to ask or present that question to the both of us. Please.
Okay. Does the blue light used in FAF have any detrimental effects on the macula?
That's a fair question. Would you like me to answer that one, Carolyn?
I will give my 2 cents if you don't mind. So my understanding, and you probably know this better than I do, is that your products in the United States have to undergo this rigorous FDA approval process. And so if there was some way that was going to cause harm to the patient's eye, I would hope that the FDA would have, given you some flag that you can't, put this on the market. I could imagine if you repeated blue light FAF like 30 times every single day for like a year, yeah, maybe you could cause some damage. But doing it in just routine clinical practice, I think totally safe. I wouldn't hesitate.
Yeah, I entirely agree, and you're right. The regulatory boards that we have to pass, even globally, but the FDA are known obviously to be extremely stringent, and for that reason, yeah, there's no concern in that respect. To allude, if you like, to elaborate on that, we use both blue and green filter sets, if you like, within our autofluorescence capabilities, and those are different wavelengths. And what I can tell you is that actually the green wavelength is one of the most preferred. The reason being is that in layman's terms, when you visualize a patient using autofluorescence, if, for example, you were looking at a blue filter set, a blue filter autofluorescence, you could see an extremely damaged, if not dead, retina. But if you were to illustrate the same patient with a different wavelength, the green filter set, that patient may actually show signs of life, shall we say, elements of that edema, etc., that we're looking at. You might physically see from a GA point of view elements that are still alive, or even new vessels, etc. So all of this is important to us from a wavelength perspective, and actually the green seems to be preferred over the blue in many cases. Do you have experience of those both, Carolyn?
Yeah, so I have a Claris. I have access to both blue and green FAF imaging. And when we're doing like a flash type of fundus autofluorescence versus say like an SLO, scanning laser ophthalmoscopy, I find that the green provides better resolution because there's less like glare and light scatter that occurs, as opposed to the blue, like especially the patient with like a cataract or something, sometimes the resolution is lower with blue, but better with green. So I typically always just do green.
Yeah, I find sometimes with blue, it can be very punchy, shall we say. It can be very contrasted. It can be very black or white, and we're kind of missing that grayscale. There's many grayscales, gray is still 50. Anyway, there's lots of grays. So, yeah. All right. So, do we have any other questions on the? Excellent. No. So, in that respect, coming back to that AMD and GA toolkit. And remember, everybody online, we've got various different highly illustrative books and educational materials. So please, you're more than welcome to fire questions at Carolyn and I. But just to kind of wrap up our conversation about that AMD and GA toolkit, there's one element that we haven't mentioned. We've mentioned the CIRRUS, phenomenal device with all of that baked in. Everybody has access to advanced RPE analysis. For those who have, for example, a CIRRUS, you may not even know you have it. It's there within the actual report functions. Angioplex, of course, I think you'd know if you had it or not. OCT angiography is a licensed feature of the CIRRUS and extremely easy to utilize with a little bit of education, if you like, from ourselves and from the book maybe I just mentioned today. But the other element is Forum. Because over my left shoulder, I pointed out the Claris. We're looking at the CIRRUS here, but all of those gel together in our software platform, Forum. So my question is, how does Forum enhance your clinical workflow, Carolyn, when you're using that AMD and GA toolkit?
Yeah, I love that Forum allows me to like incorporate multiple imaging modalities. So I can like overlay the OCT raster image on top of the color fundus photograph. So I know exactly, what that correlates with from a clinical perspective when I see a lesion. With regards to the advanced RPE analysis on Forum, there's some more like bells and whistles that come with it, where you get that graphical like trend analysis in terms of GA area progression, how close it is to the center of the fovea versus, not just the numbers, but you get to actually see the graph of the trends over time. And you can visualize 3 OCT visits sequentially and scroll through them all at the same time, which is also really valuable. I mean, not only for AMD, but other diseases as well.
Yeah, and that probably goes back to our comment about patient education as well, because when you show the layman, shall we say, the patient doesn't necessarily appreciate what we all, online here may actually see. And when we see these clinical images, when you can show the patient very clearly, look, this value is X, this value is Y, and show those images on screen, it can be really useful. So again, Forum, together with all of the other instruments, can effectively provide you much better workflow, I'm sure. And of course, as we all know, Forum actually pulls in many other devices throughout the clinic. One of the most important things from ZEISS's perspective is that digital communication and connectivity, where all of the devices, whether it's the HFA, whether it's the Claris, the Cirrus, all of these devices all speak into our Forum or a digital platform. So please enjoy and reach out to your local representative from ZEISS. It's been a pleasure for me to chat with Carolyn today. Seriously, you're a legend, a rock star. Those CE sessions for everybody were, I'm sure, extremely informative. We'll leave our chat open. If anybody's got any questions, we can pick them up and ping back. But genuinely, thank you so much, everyone, for joining us. And thank you so much, Carolyn, for your time this evening.
Oh, my pleasure.
Thank you so much.